Hi everyone, Dr. 𝒂𝒊𝒂𝒕, and I'm here to talk to you about birth trauma. TBS, or traumatic birth syndrome, is a condition that happens right at birth or shortly after birth. What happens during the trauma, during birth trauma, is that when those babies are delivered, there's a traumatic, there's just any kind of pulling, any kind of twisting happens during delivery, adds a lot of pressure, a lot of tension in the upper neck and the upper cervical. Now, 9 out of 10 kids delivered these days are going to have some sort of a traumatic, some sort of a trauma at birth, and those will go unnoticed. It's because no one actually checks the upper cervical. The medical system these days do not check the upper cervical. Well, yes, I'm very glad they're there to help deliver the babies, but those babies needs to be checked for their spine right away, right at birth, because what happens here is that they're going to when the baby's delivered, they're going to pull, any kind of pulling and twisting happening for that baby. That is a trauma. That is a trauma at birth, and guess what happens? Yes, their babies at that age, their spine is very pliable, so they can move. They will move. However, they will pull and twist. Their spine will move. But guess what? Nothing gets broken during that birth trauma, but stuff gets shifted. Okay, and that's what happens in the upper neck and the upper cervical right at birth. What happens here is that we have a special set of nerves in the upper neck. They're called which control our rest, digest, relaxation, but also our behavioral. And these are called the parasympathetic nerves. The parasympathetic nerves is part of our brainstem, which our brainstem sits right at the bottom of the skull right here. Part of the brainstem will come out from this big hole right here, which is the foramen magnum, and it ends the C1, and it lands, part of the brainstem will actually land on that C2, right there, right inside the, right in there. The other part of the parasympathetics are gonna come out from the tailbone area. So yes, these two areas right here will control our rest, digest, relaxation, but also behavior. Now, there's another set of nerves, which is our sympathetic nerves. They are right here in the mid-back area. They are fight or flight. If I'm being chased by a bear, well, guess what happens? That's what's activated. Now, during delivery, what happens here, when the baby, when they come out, when they bring the baby out, they're going to pull and twist and we'll get the baby out. But what happens here is that any kind of pulling and twisting, it's going to add a lot of tension, a lot of pressure right on the upper necks, and the baby's bones, the baby's muscles, ligaments, again, they're so pliable, they'll move, they'll shift into there, and that's where it all starts, right there. Okay, that's the shift. Is those babies are not getting checked right away at birth. So guess what? Those babies are going to grow their next steps in life, their next milestones, right? They're going to have a lot of, they're going to be very colicky. They're going to have a lot of ear infections. One of the most common ones that I see is actually torticollis. Torticollis, when I use this baby here, for example, is when how they present is that the baby actually is just baby's head is not straight up and down. It's actually tilted this way, and it stays in that position. The baby will either favor one side to feed versus the other. The baby just have a very hard time looking the other way. You'll even see like just a flat spot, right? You'll start to notice a lot like a flat spot around the back of their neck, back of their head there, because it doesn't. Their head is so stuck. Their upper cervical is so stuck in there. Those poor little things, they're not moving up there. Now, then when the question is when does birth trauma happen? In many cases, birth trauma happens when any kind of pulling or twisting happens to the neck or even the pelvis area. When getting that baby delivered, C-section, cesarean sections, when the babies come out, they make a hole just barely enough for the skull, and they are going to use any forceps, any kind of vacuum to get that baby out. And guess what? When you use a vacuum right here, and we get that pulled, all of that gets pulled with it. The upper cervical, like stress, subluxation right at birth. So those babies needs to be checked right away, get their spine checked right away to make sure that the subluxation is corrected.